I'm Julian Samuelson and I am the managing partner of the Bell Equine Veterinary Clinic. We are able here to do pretty much everything that can be done to a horse can be done at this clinic. We have facilities for surgery, which generally most days are fairly busy. We do between 250 and 300 operations a year.
This is our sterile prep area where all the surgeons will scrub up before they perform the surgeries. And so we come through here and then into the actual theatre itself. Here you can see the operating table that we use for the horses. We have big padded mats on them, which is very important when you anaesthetise horses because they're such heavy animals, it's very easy for them to get pressure points. Here is our laser machine, which is being used during surgery in order to remove the sarcoids on the horse, it's a thermal way to remove sarcoids from the horse.
Actually, we were very proud to be the first centre in the world that was capable of doing MRIs on standing horses. Up until our unit was fitted, any horse requiring an MRI had to be anaesthetised and they had to use the human type scanner in order to be able to get images of their limbs. And the unit, when it was put in here about 7 years ago, was the first in the world capable of being able to get an examination achieved on a standing horse. That has been very successful, and we are now MRIing again between 200 and 300 horses a year. We also have the facility here for bone scanning, nuclear medicine, which complements our orthopaedic case workups, and then we have the more traditional X-rays, ultrasound and so on that you would expect to see at most clinics.
In here is our scintigraphy suite, which is more commonly known as bone scan. Basically, if we have horses with multiple causes for their lamenesses, often we will be referred them by other vets. We will inject them with a radioactive substance called technetium, which this gamma camera here will pick up from the horse. This substance goes to the areas of pain in the horse and shows up as hotspots on the screen up here and down on the computer here. Although this ultrasound scanner here is mainly used for imaging limbs and backs, we also have other ultrasound scanners which are used for rectal exams and pregnancy diagnosis, and also used during AI work, artificial insemination, to see whether the horse is ready to be inseminated or where it is in its cycle. Here we have our portable radiography unit. This enables us to go out in the field to see horses and means that we get instant pictures up so that the vets can make an instant diagnosis for an owner, particularly important in the case of a suspected fracture where you don't want to be travelling the horse and want to give it immediate support if required. Over here is our large X-ray generator. This is most commonly used for getting radiographic images of the horse's chest, spine and shoulders. By contrast, this is our small X-ray generator, which is far more portable and is normally used for achieving shots of the horse's limbs.
We're lucky in the UK, and I think also particularly in Kent, that a large number of our horses are insured. And that means, because of their background, because they're mostly owned by families and they're leisure related, the individuals who own them are very keen to be able to protect them and do whatever needs to be done to them should they require complicated treatments and sometimes expensive treatments. And that has allowed us to be able to do whatever we can within reason for these cases, working with insurers carefully as well to make sure that they're comfortable with all the processes that we're carrying out.
At the moment we've got the horse in recovery that was in surgery earlier. It's got a nasopharyngeal tube in order to have oxygen given to it whilst it's coming round from its surgery, where it will be left very quietly to recover in its own time.